So what's restless leg syndrome? So restless leg syndrome is something that lots of us experience. In fact, most pregnant ladies experience restless legs at least at some stage during the pregnancy, often in the second and third trimester. And it's got four main characteristics. So the first characteristic of restless leg syndrome is that irresistible feeling of needing to move the legs. The second characteristic is that that feeling is worse in the evening or coming up to the time of getting into bed. The third characteristic is that things are worse when we're sitting still. So periods like going to the movies or an extended plane flight where we just can't move. And the fourth characteristic is that symptoms are made better by getting up and moving around. So that's how we diagnose restless legs syndrome. It's not something that we do a blood test for, it's something that we diagnose on those four symptoms. So it's very common. So about 1 in 6 people will volunteer that they get those symptoms on a reasonably regular basis. But the times we'd look at really managing it or seeing it as a disorder is when it's happening most days of the week, it's interfering with sleep and giving people a lot of trouble in the way of symptoms. So if people are getting that type of restless legs and it's interfering with what they need to do, that's when I'd investigate. And some of the assessments that we would do would be to look at iron levels. So low or borderline low iron levels can actually potentiate restless leg symptoms and make them worse than they would be otherwise. So that can be a pretty simple fix if iron levels are low, to look at replacing that to reduce symptoms. It's also important to look for other causes of restless leg syndrome. And the most common one is a problem with the nerves running from the back, down the back of the legs, nerve just being pinched in the spine, and that'll very commonly cause restless legs. People with diabetes or people getting a peripheral neuropathy where the nerves to the feet aren't working quite right will also potentially get restless legs. So part of having your doctor examine your nervous system is an important part of an assessment for restless legs. Some of the things we do for restless legs, there's some non-drug treatments available that are things like supplements. There's a role for magnesium potentially, and I've talked about iron replacement. Massage is helpful, having a warm bath before bed, putting the feet in a warm bath, having someone massage the legs can also be helpful before bed. If those things don't work and restless legs is still causing problems, then there are medications available, but that's really the sort of thing that you'd work on with your doctor, or your doctor may refer you on to a sleep specialist for an opinion about that.
For the A to Z of sleeping well, head to the Hub, sleephub.com.au.